talking about ischemic heart disease. Are sex differences in pathophysiology?
Well, we are still generating information about gender-associated differences, but clinically we can detect some differences in manifestation of disease. Therefore, we need to really invest in understanding much better the mechanisms that affect differently women and men, for not only for the presentation of disease, but also for the evolution and the beginning of atherosclerosis, that is in fact what is producing the differences. Some years ago we thought that it was only the estrogen difference, right? When the woman enters menopause, manifestation of disease is skyrocketing. But now we believe that also before menopause, there are some cases of presentation of disease that we need to study in depth. Therefore, I think this is an ongoing effort that we should not forget, and as well as mechanisms, there are other factors that we should also investigate.
Are there gender differences in major risk factors like smoking, obesity?
That was I was meaning when I said before that there are other aspects we should investigate. For example, we should investigate risk factors. How risk factors affect women and men. We know now that diabetes is an important risk factor for women because it associates with overweight and obesity. And women, when they reach a certain age, there is a tendency to gain some weight, and this weight gain is sometimes associated with diabetes, type 2 diabetes presentation, and then aggravation of the disease. This is one. We also know that, for example, in familial hypercholesterolemia, meaning that this is a trait that has a phenotype of very high LDL cholesterol levels, has effects that may be different in women and men, so we should investigate that. And lastly, I think that one important issue is the presentation of the disease, the symptoms. The symptoms are so different, and in many instances, women don't recognize as a myocardial infarction. When they need to be treated early, they are not, because women don't go to the emergency room as early as men. So in addition of research in mechanisms, research in presentation of risk factors, and the contribution of risk factors to disease, we should also produce awareness in the community of women, telling them that when they feel certain pain, it's not anxiety, it is a myocardial infarction that is developing, and they should run immediately to the emergency room to get the help that is now known, that is, if you do it in the early times, like for example primary angioplasty, will benefit also women as much as men.